if you have more medical conditions, you're going to be taking more medications. So it's a condition we call polypharmacy in the clinical literature, or multiple medications. And this can, taking lots of medications is not easy. It can affect how people want to take their medications, how regular they are taking their medication. But there may also be some interactions between medications that may limit what the doses can be of certain medications and that type of thing, and whether it affects how well these medications act. For our rheumatoid arthritis, we don't know. That's what we do. We focus on arthritis. So we have to focus on the treatment and discuss treatment options and all of that. But I think we also have to be aware of other medical conditions, because other medical conditions will impact what we choose in terms of our treatment and may affect how people do over time. But we may not be the best people to manage some of these other medical concerns, but we need to be aware of them. So we all do good histories and physicals. We all do good proper examinations for various factors, and I think we need to have a heightened awareness of it. For some conditions that are not easily tested by blood tests and things like that, there are simple screening questions that we can look for. There's simple screening questions for mental health. There's screening questions for oral health, for cardiovascular disease. I think identifying these things and then involving the appropriate people to help manage them, I think, is important. We need a team. We need to work with a family doctor. We need to work with our allied health professionals. We need to work with our other specialty providers who may be dealing with special aspects of the comorbidity. So a team approach is really critical. Not all centers have access to the team approach, but I think it's something that we should all strive for. Working with family doctors, working with nurse practitioners, having tools that kind of are almost not automated, but sort of formulated to try and make sure that we don't miss certain things, make sure we have records where we tick off that we've checked to see if these screening comorbidities, for example, have been done. I think that's important, and that requires a lot of infrastructure, requires the computing capacity, requires the people, requires the cooperation, requires infrastructure in terms of buildings to keep people in the same area. So these are things I think that our healthcare policymakers and our government officials need to be aware of. And I think as healthcare providers at all levels, nursing, physicians, allied health, and people living with arthritis, if we can inform our government officials of what the needs are, and again, it's going to vary across provinces, it's going to vary even within provinces, even within cities and regions. Every region is going to have a slightly different model, but I think we need to be thinking about this type of thing down the road.